Today we will be discussing, just watch.
In this video, I will talk about endometriosis. We'll talk about symptoms, diagnosis, and treatment. If you want to support this channel and see more videos like this, please like and subscribe. Don't forget to hit the bell button to be notified when a similar video is posted. Let's get back to where we were. Endometriosis is defined as the presence of endometrial glands and stroma outside the uterus. There are many theories that are suggested for the development of endometriosis. The most acceptable one, however, is retrograde menstruation. Therefore, endometriosis can be found anywhere in the pelvic cavity, like the ovary, the tube, anywhere in the peritoneum, the bladder, the bowel, or behind the uterus on the uterosacral ligament or the cul-de-sac. Risk factors for endometriosis include age of menarche less than 11 years old, if the cycles are shorter than usual, or in case of heavy prolonged cycles. It's important to mention that increased parity and high duration of lactation are protective against endometriosis. Symptoms include dysmenorrhea or painful period, usually before the onset of menses, chronic pelvic pain, and deep dyspareunia or painful intercourse. Tenesmus can occur in case of bowel involvement, and dysuria can occur in case of bladder involvement. Heavy bleeding can occur in case of uterine involvement, what we call adenomyosis. The diagnosis is mainly made clinically by obtaining history and performing clinical examination. During the examination, the patient may have pelvic tenderness or nodularity on the uterosacral ligament. In case of adenomyosis, the uterus usually feels bulky. Ultrasound scan can show an endometrial cyst, which is called endometrioma, or can show islands and lacunae in case of adenomyosis. Definite diagnosis can only be made laparoscopically, not only by visualization of the lesion, but by obtaining biopsies for histological examination. Treatment is divided into medical and surgical. Medical treatment involves treating the pain with non-steroidal anti-inflammatory drugs like naproxen and progesterone orally or intramuscularly, or by giving oral contraceptive pills. If the previous measures don't help, gonadotropin-releasing hormones agonist and antagonist can be tried. It is important to remember that the patient may develop symptoms of menopause with those medications, like hot flashes and night sweat. It can also lead to osteoporosis. Therefore, it's important to add estrogen, called add-back therapy, to minimize the risk. Surgical treatment is important in case of infertility to remove the endometrioma and treat any lesion either by excision, which is preferred, or by cauterization. Hysterectomy with or without bilateral salpingectomy is the definite therapy for endometriosis. Some patients undergo a second operation to remove the ovaries if this procedure was not done with the hysterectomy. Hysterectomy should be done if the patient is having disabling pain and the medical management has failed and the patient has completed her family, or in a well-counseled patient. I will cover the effect of endometriosis on fertility and its treatment in the infertility video. Don't forget to check out my books on Amazon. One of them is called OBGYN Made Easy, Don't Waste Time on the Shell, The Pearl is Inside, and the other one is for questions and answers. And the links are provided below. If you want to support this channel, please like and subscribe. If you have any question or any suggestions, please leave them in the comments below and I will do my best to address them. Guys, my commitment to you is to provide you with the latest information based on the most recent American College of Obstetrics and Gynecology guidelines. Thank you and see you next time.